Okay, good afternoon. We will go ahead and get started. Welcome to the third meeting of Health Services Standing Committee. We will go ahead and call the roll, please, DJ.
Representative Bentley. Yes, Representative Bratcher.
Here.
Representative Bray.
Present.
Representative Burke.
Present.
Representative Callaway.
Present.
Representative Camuel.
Here.
Representative Duval.
Here.
Representative Frazier Gordon. Representative Justice. Representative Neighbors.
Here.
Representative Rayburn.
Here.
Representative Raymer.
Here.
Representative Riley. Here. Representative Rourks.
Here.
Representative Sharp. Representative Wilner.
Here.
Representative Whidden. Vice Chair Dotson.
Present.
Chair Mosier.
I'm here. Okay, we have a quorum established to do business, and some of our members are between committees. State government meets at the exact same time, and we are going to go out of order a little bit today unless we update the agenda. We will be taking up House Bill 166 first, and I will hand over the gavel to my vice chair now for a few minutes while I go to state government and present a bill. So just make your way to the table, and Chair Dotson will take over. Thank you.
Thank you, Chairwoman Mosier. This time, we will be hearing House Bill 166 by Representative Nemus. You make your way to the testimony table, and along with your guests that you may have, please introduce yourself for the record, and you may proceed.
Thank you, Mr. Chairman. Jason Nemus, State Representative in the 33rd District. That's Jefferson, Overland, and Shelby counties.
I'm Jimmy Pollard. I'm Executive Director for the Kentucky Corners Association.
Can you pull your mic just a little closer? Sorry about that.
Hi, my name is Angie Needers, and I am trying to get this law passed in honor of my daughter, Jamie's Law, for SUDEP awareness.
Steve Riley, State Representative, 23rd District.
Thank you, Mr. Chairman. There is a committee sub. I'll explain the difference in the committee sub and the regular, and then I'd ask for it to be called if that will be appropriate.
Yes.
So we've made a couple changes in the committee sub, 3 to be exact. One is we've had the removal of Section 1, which would require the doctor to make notifications to the parent of a child who has epilepsy. It's our understanding that the best practices from the American Academy of Neurologists already encourage physicians to provide that information to their parents of the risks of SUDEP, and the Medical Association in Kentucky and the Epilepsy Foundation will work together on physician educational opportunities about SUDEP. That was one difference we made. The other one was, or the two were made when we worked with Mr. Pollard on behalf of the coroners, and that's to make sure that the family request is made to the coroner, because in Kentucky the coroner is the one who orders the autopsy. And then we also have vital statistics forward the death certificate to the National Registry, since it'll be one group sending it rather than 120 coroners. So that's the difference between the committee sub and the original bill.
Is there a motion to adopt the committee sub?
Second.
We have a first and a second. Motion. I wanted to use that gavel.
You do it again, I didn't.
Motion accepted.
Thank you,
Please continue.
Thank you, Mr. Chairman. A lot of us don't know, so I'll just go into kind of the background of what this is. SUDEP is the sudden, unexpected death of someone with epilepsy who is otherwise healthy. In SUDEP cases, no other cause of death is found when the autopsy is done. In 2015, the CDC reported that each year, more than 1 in 1,000 people die, or with epilepsy die from SUDEP. However, with more data now available, the estimate is significantly higher for those that have frequent and or uncontrolled seizures. SUDEP takes more lives in the United States annually than SIDS. We all have heard of SIDS, and autopsies are performed when SIDS is suspected. How many of you have heard of SUDEP? I know I hadn't. No one is sure what causes SUDEP and how prevalent it is, hence the reason for the bill. And you're going to hear from my constituent Angie that this can happen when taking an afternoon nap. Kentuckians have nearly 4 times the national average of persons with epilepsy. So we need to do our part to help answer those questions of how prevalent it actually is, which is why we filed House Bill 166. The SUDEP registry is a collaborative effort to collect clinical information, autopsies, family interviews, and other information used to study causes and risk factors that lead to SUDEP. Determining suspected SUDEP in an autopsy is pretty straightforward. If the death is not known to be related to an illness, accident, or seizure emergency, and the autopsy reveals no toxicologic or anatomic cause of death, it falls under the guidelines of being classified as SUDEP. 4 states, New Jersey, Illinois, North Carolina, and New York, hopefully Kentucky soon, have already passed legislation requiring an autopsy when SUDEP is suspected. New Jersey and Illinois have been reporting their data for 10 years. House Bill 166 only requires the autopsy if requested by a family and ordered by the coroner. So with that, I'm going to ask Angie to have her comments, and then we'll take questions if you like.
Once again, my name is Angie Needers, and I'm here on behalf of my daughter.
Excuse me, can you just speak?
Oh,
pull the
I'm
microphone?
sorry.
It's okay.
Again, my name is Angie Needers, and I'm here on behalf of my daughter, Jamie Smith. Thank you for allowing me the opportunity to testify today. And I want to thank Representative Jason Nemes for sponsoring this very important bill. My daughter, Jamie Smith, this is my daughter, Jamie Smith. I'm sorry. Jamie was
It's okay, take your time.
Jamie was 14 years old when she laid down on 9/11/19 to take a nap after school. 45 minutes we went in there to check on her, and she was unresponsive. She had been diagnosed with epilepsy, generalized tonic-clonic seizures, in the year 2014. If you read about SUDEP, you will see terms like rare or 1 in 1,000. Since Jamie's passing, I have joined several SUDEP support groups, and even I created one. As I talk with parents who have also experienced this same tragedy, I can tell you that this is not a rare occurrence. The problem is there is not enough data that is being provided. We need more than four states providing autopsy data to the National Registry. Kentucky is a state that definitely needs to be a participant, since our state of epilepsy could be up to 4 times higher than the national average. No parent wants their child's death to be a statistic, but I am here asking for just that. I want Jamie's death to be part of the statistics being collected by the National Registry so that there is a good data for research. That is the only way that we can make a change and increase this very important conversation about SUDEP, because every parent of a newborn knows about SIDS, but not every parent of a child with epilepsy knows about SUDEP or even thinks it's rare, because there is not enough data for researchers. I had to fight to have Jamie's cause of death identified as SUDEP. No parent who has just lost a child should have to fight so that a child can be a statistic. Please pass House Bill 166 and help us support much needed research by providing data, very critical data on SUDEP. Thank you.
Thank you. I just want to make a few comments. I know many of you have met my son Kevin, and Kevin had seizures, and so this is near and dear to my heart, because I have great empathy for those who suffer from seizures, because it impacts their life significantly no matter what type of seizures they have. It could be physical, it could be emotional, it could be what they're not allowed to do, and also have great empathy for family members that live this life and go through this and suffer along with their children. And I think we owe it to family members to pass this bill so they can understand what their child's had to go through, and what has happened. So I support that for this reason, and you did a great job.
Thank you, sir.
Got a motion on the bill, but I do have a couple questions in the queue. Representative Jacob.
Thank you, Chairman. I think this is a no-brainer. It's a great bill. I'm just curious. The first thing I wrote down was SIDS, and that's a common because they're newborn and they may not know they're epileptic. So, can a parent option into this data if their kid was termed having SIDS?
Are you asking, can they look to see if...
Yeah.
So actually there is, I've been reading about possible research on that they may be looking into SUDEP as a cause of SIDS.
Because they're the infants, you may not know they're epileptic yet.
Right.
And
that's very interesting you bring that up, because I had just read an article, as a matter of fact, yesterday, that they were talking about infants. Gosh, I wish I'd print that up. But they are actually looking more into that to see if seizures could have been possibly related to that.
Yeah, because sudden infant death syndrome, it's basically saying
right.
We don't know.
And then there's also sudden unexpected death in childhood as well.
Yeah, so it could be SUDEP.
And yes, very much so.
And with the state having 4 times the national average, I think this is a great thing, and I appreciate y'all bringing it.
Thank you.
Thank you, Mr. Chairman.
Representative Bentley.
Thank you, Mr. Co-Chairman. Mr. Chairman, I have a question. You're the coroner, right?
No, sir, I'm not the coroner any longer. I was coroner for 35 years and retired. I'm now the executive director for the Coroners Association.
I have a technical question. When they do a postmortem of epilepsy, is hypoxia to the brain usually the call on that?
Well, in an autopsy on a subject that has been diagnosed with epilepsy, it's mostly a process of elimination. As Representative Nemus mentioned, it's an examination of other vital organs. If nothing is wrong otherwise, then it goes back to be epilepsy. If they may have a heart condition, and then epilepsy will be a secondary.
I've had may I follow up?
Yes, you may.
When 2 weeks ago, I was at the hospital doing my therapy, and a friend came by with a seizure, and she died. And I was there with the doctors talking about it, and what happened to her was no oxygen got to the brain. So that's the reason I asked if there was any statistics with hypoxia related to this condition.
I'm not certain. I'm not for sure whether there is. I'm sure there somewhere. I'm not aware of them, though.
Thank you, sir. Thank you, Mr. Chairman.
Representative Frazier Gordon.
Thank you. I have a clarification and another question, if I may, sir. So in regards to Representative Justice's question regarding SIDS and the unexpected death in children, so would those two groups be able to participate in this study and have their data sent as well, or is it strictly for the SUDEP group?
So it's my understanding that there already is a registry for SIDS.
Okay.
And that we test for that. This would be for SUDEP.
Okay.
So that's not to say that a child couldn't be on both lists if they're.
Very good. And then my question is just for a matter of education. Is there any speculation as to why Kentucky is 4 times more likely? Is there any lifestyles or anything that they suppose that it may be linked to?
I know Karen Lentz looked up some statistics. She works for the Epilepsy Foundation of Kentuckiana, so she found that information.
I'm with the Epilepsy Foundation of Kentuckiana, and we're not 100% sure why the risk is greater.
Please identify yourself for the record.
My name is Beth Stivers. I'm the director of the Epilepsy Foundation of Kentuckiana. We're not 100% sure why the risk is higher for Kentuckians, probably just because our health statistics are terrible as it is. So just lifestyle choices and things like that can also lead to a greater risk of epilepsy. So does that answer your question?
Yes, thank you.
Thank you. Ms. Neters, I'd just like to say thank you for your courage of coming in here and sharing your story with us today. And not only that, to make us aware. I really didn't know about this until this bill came to light. And I want to thank you for your courage. Once again, you have a beautiful baby. And
Thank you.
God bless you.
Thank you so much.
So we have a motion on the bill. We got a first by Representative Bray, a second by Representative Callaway, as amended by Committee Substitute 1. Please call the roll.
Representative Bentley. Representative Bratcher.
Yes.
Representative Bray.
Yes.
Representative Burke.
Yes.
Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Frazier Gordon.
Yes.
Representative Justice.
Yes.
Representative Neighbors.
Yes.
Representative Rayburn.
Yes.
Representative Raymer.
Yes.
Representative Riley.
Yes.
Representative Rorks.
Yes.
Representative Sharp.
Aye.
Representative Wilner.
Yes, thank you.
Representative Whitten.
Yes.
Chair Mosier.
Yes, and I apologize for missing the presentation. Passes unanimously, and the same should pass on the House. Thank you.
Thank you very much.
Thanks, Coach.
Next, I would like to call up Representative Danny Bentley to present House Bill 274, please.
Okay, perfect.
Thank you, Chair Lady. May I continue?
Please do. Introduce yourself for the record and introduce your guest, and please proceed.
My name is Danny R. Bentley, District 98 of the Great Commonwealth of Kentucky, State Representative. And to my right is the President of KPHA, and she will introduce herself.
Great. Thank you, Representative Bentley. Good afternoon. My name is Brooke Hudspeth, and I am currently serving as the President of the Kentucky Pharmacists Association, who I am speaking on behalf of today. Thank you, Chairwoman Mosier and committee members, for allowing me the opportunity to speak to you today in favor of House Bill 274. Pharmacists play a vital role in promoting public health across the nation and in Kentucky. When childhood immunization rates plummeted during the COVID-19 pandemic, the federal government asked pharmacists to help fill in the gap. Under the PrEP Act, pharmacists were called upon to provide childhood immunizations to children aged 3 years and older to help improve access to care. This authority expired with the end of the declared public health emergency, thus blocking a critical access point for childhood vaccinations. House Bill 274 simply codifies a practice that pharmacists across the state have been performing for the past 4 years so that we can ensure continued access to care that children and their parents have come to expect. Pharmacists are trained and educated to screen and administer immunizations to children and adults. Thanks to strict accreditation standards, every pharmacist that graduates with a PharmD receives extensive training in screening patients of all ages for appropriate immunizations, the technical skills of how to administer immunizations, and knowing when to refer patients to a pediatrician for more in-depth care. Your constituents and our patients have come to rely upon access to immunizations at their local pharmacy. I ask you to please support this legislation and secure continued access to immunizations for children across Kentucky. On behalf of the Kentucky Pharmacists Association, thank you to Representative Bentley for being a champion of this legislation, and thank you to the entire committee for your time, attention, and support.
Shirley, I'd like at this time to thank the Kentucky Medical Association who are working with me very closely on this bill, and they've been very cooperative, and I want to thank them publicly. This is not a mandate, so the parents would not be mandated to take their child in. It's really, this bill is for those counties without pediatricians, and we know that most people are within 5 miles of a pharmacy. So we are lacking in Kentucky behind on the normal vaccinations. I don't call COVID a vaccination yet, but on those that we really get, like diphtheria, tetanus, pertussis, and so forth. So that's what this is for, and we're trying to prevent a public health crisis with our childhood vaccines by this bill. I have a committee sub.
Motion on the sub.
Second.
Okay, we have a motion and a second on the sub. All in favor, please indicate by saying aye.
Aye.
Any opposed? All right. Are there any changes that you would like to discuss within the sub?
The sub went from 3 years to 5 years, and that was with a negotiation with KMA. I think it's a good idea because that keeps the 4-year check with the pediatricians. And like I said before, we're lacking 51 counties without pediatricians. So we also need to know in the future to educate more and put more funding into that in the state of Kentucky.
Motion on the bill is amended by the sub.
All right, we have a motion on the bill as amended by the committee sub. And did we have a second? Second? Okay. All right. Do we have any discussion? Any questions? Okay. I would just like to thank you for your work. I know that you've been working on this for quite a while, and in light of our public health, I'm not sure if I'm ready to call it a crisis, but we don't want it to become that, and we want to make sure that children are protected from communicable diseases, and vaccines have been proven to keep children safe. Again, I appreciate that this is not a mandate, that this is voluntary. But it does increase the convenience factor for families and parents and ensures safety and just protection. So thank you.
Thank you.
Okay. All right. Seeing no questions, DJ, will you please take the roll?
Representative Bentley,
Yes.
Representative Bratcher,
Yes.
Representative Bray,
Yes.
Representative Burke,
Yes.
Representative Callaway,
Yes.
Representative Camuel,
Yes.
Representative Dotson,
Yes.
Representative Duval,
Yes.
Representative Frazier Gordon, Representative Justice,
Yes.
Representative Neighbors,
Yes.
Representative Rayburn,
Yes.
Representative Raymer,
Yes.
Representative Riley, Representative Rourks,
Yes.
Representative Sharp,
Aye.
Representative Wilner,
Yes.
Representative Whitten,
Yes.
Chair Mosier.
Yes. Okay. House Bill 274, as amended by the committee sub, passes with favorable expression, and the same should pass on the House. Congratulations.
Thank you. Thank you, committee.
And thank you for your service.
Thank you.
Okay, I will make my way to the table to discuss House Bill 115. So once again, I will pass the gavel to my vice chair and invite Representative Wilner, and we have a guest on Zoom as well.
The green lights.
Yes. Good job.
Representative Mosier, you may introduce yourself and your guest, and you may proceed.
Thank you, Mr. Chair, and thank you to my guests for being here. I am Representative Kim Mosier. I represent the 64th District, and I will invite my guests to introduce themselves.
Thank you. Representative Lisa Wilner, House District 35.
And online, we have Miss Dana Carter with the Susan G. Komen Foundation. If you could just make it official and introduce yourself.
Sure. Good afternoon. My name is Dana Carter. I'm the Regional Manager of Policy and Advocacy for Susan G. Komen.
Okay, thank you. Well, we have some experts here really to speak on this bill, so I'll just do a quick introduction and just say that this bill really is about early detection of breast cancer. It'll ensure that individuals at high risk for breast cancer have access to diagnostic mammograms or follow-up imaging. This is obviously needed to rule out breast cancer or the need for further testing. I think at this time, I'll just hand it over to either of you if you'd like to say a few words, and then we will invite Ms. Carter.
Thank you. And I'll just say that we know that Kentucky has very high rates of cancer overall. So I looked at the National Cancer Institute and the CDC, and the good news is that overall, our overall cancer numbers are declining, but breast cancer is one of the areas that's actually on the rise in Kentucky, really emphasizing the importance of this bill. And that's all I'll say before Dana has her testimony.
Good afternoon. Again, I'm Dana Carter, the Regional Manager for State Policy and Advocacy for Susan G. Komen. Vice Chair Dotson, members of the committee, thank you for the opportunity to provide testimony on House Bill 115, which relates to coverage of medically necessary breast imaging. Mammography is only the initial step in the early detection process, and it is not able to diagnose cancer alone. Early detection of breast cancer is not possible without medically necessary follow-up imaging or additional supplemental imaging, which is required to rule out breast cancer or confirm the need for a biopsy. An estimated 12% of women screened with modern digital mammography will require that follow-up diagnostic imaging. A Komen Commission study recently found that out-of-pocket costs for patients to be high, with much variation for diagnostic breast imaging. For example, the average patient cost for a mammogram is around $250, and for a breast MRI, over $1,000. The study also found that this inconsistency in cost and coverage is a recognized concern among patients and healthcare providers, which leads to that additional stress and confusion for patients already dealing with the daunting possibility of a breast cancer diagnosis. Additionally, a recent study published in the magazine Radiology found that 1 in 5 patients would not go in for the recommended follow-up cost if they had to pay a deductible. Unfortunately, we receive many calls and emails from individuals who are unable to pay the out-of-pocket costs for the recommended follow-up breast imaging. Without assistance, many simply will delay or forego these medically necessary tests. This can mean that patients will not seek care until the cancer is potentially spread, making it much more costlier and deadlier to treat. Breast cancer can be up to 5 times more expensive when it has spread beyond the breast to other parts of the body. For example, I will share the story of a patient we worked with recently. She had an $80 copay for a diagnostic mammogram. She couldn't afford to pay the $80 because she was recently divorced and just didn't have the resources to get groceries and to get a diagnostic mammogram. So she waited 6 months to try to save up the necessary money. However, because the immense amount of pain she was in, she decided to go get a payday loan to make up the cost and to get her diagnostic mammogram. The outcome was she had cancer that had spread to other parts of her body. She lost her breast, and she had to do both chemotherapy and radiation, all for the sake of $80. Susan G. Komen encourages you to support House Bill 115, which will eliminate cost sharing for medically necessary breast imaging services. Thank you to Representative Moser and Representative Wilner for bringing this important legislation. Thank you for your consideration.
We're available for any questions.
Motion. I see no one in the queue. Representative Bray.
Thank you all. I'm looking at the fiscal mandate on this. Yep. 0 to 2.5 million for policies, but then in the next paragraph it says it will increase the total cost of health care in the Commonwealth 0 to 2.5 million. Is that in addition that above the policy level onto the healthcare system level? Can you help me understand the fiscal mandate?
So I think that what this means is it says that it represents an increase of approximately 0 to 0.1%, or approximately 0 to 2.5 million. That's because it's well, I mean, in answer to your question about whether or not, I guess it's the actual insurance or on top of the coverage, I believe it would be on top of. Okay. And so it would be a 0 to 57 cent per member per month possibility. Okay. And, you know, this is all based on probably a very small population of women who need medically necessary, that secondary diagnostic mammogram. Mm-hmm. So that's why it's, you know, 0 to whatever the number is. It's very hard to say. And I would like to point out that the health impact study also includes a note that says, it is acknowledged that there is a potential for long-term savings due to increased affordability and accessibility to cancer diagnostic testing, which could lead to earlier detection of cancer. This was considered in estimating the fiscal impact range. However, a full cost savings analysis was not included due to time and budget constraints. So, you know, again, they're really trying to look at the return on investment, and I think that's delineated.
Okay, thank you.
Yep, thanks.
There be any other questions? Just like to quickly thank Ms. Carver for your testimony, and it shows the necessity of why this bill is necessary. Thank you for that today. Okay.
Thank you for this bill. I just have one question, and you know, there are some age requirements on page 3. In this bill, if someone is suspected to have found something during their physical examination of their self and go to their physician with that concern, would this bill, if they're under the age of 30, would this bill protect them, and would that allow them to have further diagnostic testing as needed?
Are you asking me? Sorry.
Turn your microphone on. There you go.
Can you hear me? I'm sorry. I forgot to turn my microphone on. Did you hear the question?
Yes.
Okay.
Yeah, sorry. The technology here was going in and out. I sincerely apologize. No. I believe so. Yeah, the question would I believe so. For any medically necessary, it would be, they would, if your physician essentially says that you need to go in and they've went in for that initial screening mammogram, and then their physician says, yeah, we need to get this checked out, they would be covered no matter the age, I believe.
Chairman, short follow-up.
Sure.
I've heard from a lot of folks under the age of 30 who have actually experienced a situation where their insurance would actually not cover further diagnostic testing. I've actually got a cousin who at the age of 29 had a double mastectomy, stage 4 breast cancer, and the numbers are increasing. So I'm happy to see this bill, and thank you for the work on that.
If I could just thank you for the question, Rep. Rayburn, and I just agree. You know, we know that those rates are rising for individuals under 30, and I think the reason that the reason that we have the age limit in here is because this would be a follow-up from a regularly covered mammogram, and since regular routine mammograms aren't routinely recommended or covered by insurance policies, that's why it's written this way. But I think you raise a really important point.
Mm-hmm. Thank you.
Representative Rayburn.
I just want to thank you for bringing the bill. You know, a lot of people here know I lost my aunt last August, age 55, with a recurrent and aggressive form of breast cancer. And, you know, as far as like the financial impact, I know that treating a late stage cancer, it's much more costly than treating early stage. So I think there's even potential for cost savings. And I just want to thank you for bringing the bill.
Thank you. And I'm so sorry about your aunt.
Will there be any more questions? I'd like to just quickly state that Representative Moser, you keep your finger on the pulse of what's going on in the medical community, and we thank you for being proactive and bringing really meaningful bills to our committee. Thank you so much. So at this time, I have a
motion on the bill.
Got a motion and a second. DJ, please call the roll.
Representative Bentley. Representative Bratcher.
Yes.
Representative Bray. Representative Burke.
Yes.
Representative Callaway.
Yes.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Frazier Gordon. Representative Justice.
Yes.
Representative Neighbors.
Yes.
Representative Rayburn.
Yes.
Representative Raymer.
Yes.
Representative Riley. Representative Rourks.
Yes.
Representative Sharp.
Aye.
Representative Wilner.
Yes.
Representative Whitten.
Yes.
Chair Mosier.
Yes.
House Bill 115 passed unanimously, and the same should pass in the House floor. Our next scheduled meeting of the House Standing Committee of Health Services will be Thursday, February the 8th of 2024 at noon in room 149. Can I get a motion for adjournment?
Motion.